There is a food that has been eaten by human civilizations for thousands of years, that grows in conditions where other crops fail, that costs less than $2 for a week's worth of servings, and that contains a more specific, better documented combination of nutrients relevant to prostate health than most specialty supplements marketed specifically for that purpose. It is not exotic, it is not trendy. It is not something you need to order online or find in a specialty health store. It is sitting in the bulk bins and dried goods aisle of virtually every grocery store in the world. The food is pumpkin seeds, and I want to spend the next several minutes giving you the complete, honest case for why these should be part of every man's prostate health routine, based on the specific compounds they contain, the mechanisms through which those compounds act on prostatic tissue, and the clinical evidence that supports their use. I am Dr. John, and this is not a video about a miracle cure. It is a video about a genuinely exceptional food whose nutritional composition happens to address several of the most significant biological drivers of prostate disease simultaneously in a way that very few single foods can claim. Before we begin, leave a comment with your age and whether you already incorporate pumpkin seeds into your diet. I read every comment, and the patterns in your answers genuinely influence what I focus on going forward. Let me start with the nutritional composition because the specific compounds in pumpkin seeds and their concentrations are what make this food remarkable rather than simply generally healthy. Zinc is the compound that puts pumpkin seeds in a category of their own for prostate health. Pumpkin seeds are among the single richest dietary sources of bioavailable zinc available anywhere. A standard serving of approximately 30 grams of raw pumpkin seeds, roughly a small handful, provides approximately 8 to 9 milligrams of zinc, which represents the majority of the daily adequate intake for adult men. Why does zinc matter so specifically to the prostate? For a reason that distinguishes the prostate from almost every other organ in the body. The prostate accumulates and concentrates zinc at higher levels than virtually any other tissue. In a healthy prostate, zinc concentrations can be 10 times higher than in most other body tissues. This extraordinary zinc concentration is not incidental. It reflects specific biological functions that zinc performs in prostatic tissue. Zinc directly regulates the activity of 5-alpha reductase, the enzyme responsible for converting testosterone to the more potent dihydrotestosterone, or DHT, within prostate cells. DHT is the primary androgenic driver of prostatic cell proliferation and the target of pharmaceutical 5-alpha reductase inhibitors including finasteride and dutasteride. Adequate zinc status supports normal regulation of this enzymatic activity in a way that reduces the conversion rate of testosterone to DHT at the cellular level. Research examining zinc concentrations in prostate tissue from men with BPH compared to healthy prostate tissue has consistently found that BPH tissue contains markedly lower zinc levels than normal prostatic tissue. This finding suggests that zinc depletion within prostate cells is associated with the loss of normal regulatory control over cell proliferation and the progression of benign enlargement. The relationship between zinc status and prostate health is not simply correlational. It reflects specific cellular functions that zinc serves in maintaining normal prostatic tissue behavior. After 50, dietary zinc absorption declines measurably due to reduced stomach acid production, which is required for efficient zinc absorption and increased zinc loss through various metabolic pathways. This makes older men disproportionately vulnerable to subclinical zinc insufficiency, a state in which serum zinc tests appear borderline or normal, but tissue-level zinc concentrations, particularly in the prostate, have quietly declined below the levels required for optimal function. Dietary zinc from food sources is preferred over zinc supplementation for several reasons. Zinc from food comes packaged with other compounds that influence its absorption and utilization. And importantly, long-term zinc supplementation in excess of about 40 milligrams daily interferes with copper absorption, creating copper deficiency as an unintended consequence. Food-based zinc from pumpkin seeds, consumed regularly rather than in a megadose, avoids this problem while consistently supporting prostatic zinc status. Beta-sitosterol is the second major compound in pumpkin seeds that demands specific attention. Beta-sitosterol is the most abundant phytosterol in pumpkin seeds, and it is the compound with the most direct and well-documented evidence for improving the specific urinary symptoms associated with BPH. Phytosterols are plant-derived compounds structurally similar to cholesterol that compete with cholesterol for absorption from the intestine and that have multiple documented effects on inflammation and cell signaling. A meta-analysis of randomized controlled trials examining beta-sitosterol specifically for BPH symptoms, published in the Cochrane Database of Systematic Reviews, concluded that beta-sitosterol significantly improved urinary symptom scores and urinary flow measures compared to placebo. The improvement in International Prostate Symptom Score across trials averaged several points, which represents a clinically meaningful symptom reduction. The improvement in peak urinary flow rate was also statistically significant. These are the same outcome measures used to assess pharmaceutical treatments for BPH, which makes the comparison meaningful. Beta-sitosterol appears to work through anti-inflammatory mechanisms that reduce the prostatic inflammatory infiltration driving BPH progression, and through direct effects on prostate cell signaling that modestly inhibit the proliferation of prostatic epithelial and stromal cells. Its effects are gentler and more gradual than pharmaceutical interventions, which is consistent with a food-based compound operating through multiple pathways at physiological rather than pharmacological concentrations. The delta-7 sterols found specifically in pumpkin seed oil add a further dimension to the phytosterol profile. These compounds have been studied for their ability to inhibit the binding of DHT to androgen receptors in prostate cells, providing a complementary hormonal mechanism alongside the zinc-mediated regulation of DHT production. The combination of reduced DHT synthesis through zinc activity and reduced DHT receptor binding through phytosterol action represents a more comprehensive androgenic modulation than either mechanism alone. Cucurbitane is a specific amino acid compound found in pumpkin seeds with documented anti-inflammatory properties. It is not found at meaningful concentrations in most other foods, making pumpkin seeds a somewhat unique dietary source. Cucurbitane has demonstrated inhibitory effects on the inflammatory pathways relevant to both BPH and prostatitis, the inflammatory condition of the prostate, that affects a significant proportion of men and produces the pelvic pain, urinary urgency, and ejaculatory discomfort that can accompany prostate disease. The lignans present in pumpkin seeds provide a further relevant mechanism. Lignans are phytoestrogens, plant compounds with weak estrogen-like activity that modulate the hormonal environment in ways relevant to prostate health. In men, the hormonal shift of aging involves rising estrogen relative to testosterone, partly because declining testosterone is accompanied by the increasing aromatase activity of age-accumulated visceral fat. Dietary lignans appear to modulate this estrogenic environment in ways that reduce the estrogenic promotion of prostatic epithelial cell proliferation. They also interact with sex hormone-binding globulin in ways that affect the ratio of free-to-bound testosterone available to prostatic tissue. Magnesium is present in pumpkin seeds at concentrations that make a genuine contribution to daily magnesium needs. Magnesium is widely deficient in the diets of older adults and has multiple relevant effects on health, including regulation of the neuromuscular function of the bladder wall. Magnesium deficiency is associated with bladder hyperactivity and overactive bladder symptoms, which frequently accompany BPH and compound the obstructive symptoms of prostate enlargement. Adequate magnesium status supports appropriate bladder wall compliance and may reduce the overactive bladder component of lower urinary tract symptoms. The fatty acid composition of pumpkin seeds is worth specific attention. Pumpkin seeds contain a mix of monounsaturated and polyunsaturated fatty acids, including linoleic acid and alpha-linolenic acid, a plant-based omega-3 fatty acid. While the conversion of alpha-linolenic acid to the more biologically active EPA and DHA is inefficient, particularly in older adults, the fatty acid profile of pumpkin seeds supports a more favorable overall inflammatory tone that contributes to the anti-inflammatory environment relevant to prostate health. Now, let me address what the clinical evidence from human studies actually shows, because laboratory compounds become clinical recommendations only when human evidence supports them. A randomized, double-blind, placebo-controlled study conducted in men with BPH found that daily supplementation with pumpkin seed oil produced significant improvements in IPSS scores, quality of life measures, and maximum urinary flow rate over 12 months compared to placebo. These improvements were not dramatic, but they were statistically significant and clinically meaningful in the context of mild to moderate BPH symptoms. Importantly, pumpkin seed oil supplementation produced these benefits with no significant adverse effects reported across the treatment period, which compares favorably to pharmaceutical interventions for BPH that typically carry side effect profiles including sexual dysfunction, dizziness, and in some cases, more serious risks. A Korean study examining pumpkin seed oil specifically in men and women with overactive bladder found significant reductions in urinary frequency, urgency, and nocturia compared to placebo after 12 weeks. This overactive bladder benefit is relevant to men with BPH because the overactive bladder response, the bladder wall hypersensitivity that develops from years of pushing urine through an obstructed outlet, frequently coexists with the obstructive symptoms and compounds the overall symptom burden. How to incorporate pumpkin seeds for maximum benefit? Raw, unsalted pumpkin seeds are the preferred form because heat processing reduces the phytosterol content and may affect the bioavailability of some compounds. Roasted pumpkin seeds, while still nutritious, provide somewhat reduced concentrations of the specific compounds most relevant to prostate health. If you find raw pumpkin seeds less palatable, lightly toasted seeds at low oven temperatures are a reasonable compromise. The shell-free variety, sometimes called pepitas, provides all of the relevant compounds in the seed flesh without requiring the work of shell removal. Both shelled pepitas and shell-on seeds contain the active compounds, but shelled pepitas are more convenient for daily use. A practical daily serving is approximately 25 to 30 grams, which is roughly a small handful or about 3 to 4 tablespoons by volume. This serving provides meaningful amounts of zinc, beta-phytosterol, magnesium, and the other compounds discussed without creating concern about excess intake of any specific nutrient. Timing of consumption has some practical relevance. Consuming pumpkin seeds with a meal that includes some healthy fat enhances the absorption of fat-soluble compounds, including phytosterols. Mixing them into a salad dressed with olive oil, combining them with avocado, or eating them alongside a meal containing fish or other healthy fat sources optimizes their bioavailability. Pumpkin seed oil as a supplemental concentrated source is available in capsule and liquid form and has been used in the clinical studies demonstrating symptom benefit. If you find consistent daily consumption of whole seeds challenging to maintain, high-quality cold-pressed pumpkin seed oil in capsule form provides a concentrated alternative. Cold-pressed extraction is important because heat processing degrades the active compounds. Look specifically for cold-pressed or expeller-pressed products stored in dark glass or opaque packaging to minimize light oxidation. Let me now address where pumpkin seeds fit within a comprehensive dietary approach to prostate health, because no single food operates in isolation. Pumpkin seeds address zinc replenishment and the regulation of 5-alpha reductase activity. They provide beta-phytosterol with documented BPH symptom benefit. They contribute cucurbitin with anti-inflammatory specificity for prostatic tissue. And they provide lignans that modulate the hormonal environment relevant to prostatic cell proliferation, alongside cooked tomatoes providing lycopene for antioxidant protection and IGF-1 signaling modulation, alongside properly brewed green tea providing EGCG for 5-alpha reductase inhibition and anti-inflammatory activity through nuclear factor kappa B inhibition. alongside fatty fish, providing EPA and DHA for systemic anti-inflammatory effects, alongside cruciferous vegetables providing sulforaphane for detoxification, pathway support, and hormonal balance. Together, these foods create a dietary environment that addresses inflammatory, hormonal, metabolic, oxidative, and vascular dimensions of prostate health through mechanisms that are not duplicative but genuinely complementary. Each food has a specific role in the composite picture that the others do not fully cover. Pumpkin seeds' particular contribution, the zinc-mediated regulation of DHT production, and the beta-cytosterol-mediated improvement in urinary symptoms, represents a mechanism that is not substantially covered by any of the other foods in this comprehensive dietary approach. They are not redundant. They are filling a specific gap. I want to close with a word about realistic expectations, because honest communication is what distinguishes genuine health information from marketing. Pumpkin seeds are not going to reverse significant BPH structural enlargement. They are not going to produce the rapid symptom relief that alpha blocker medications provide. In men with severe obstructive symptoms, urinary retention, or significant post-void residual, they are not a substitute for appropriate medical evaluation and treatment. What they are is a genuine, inexpensive, well-tolerated, evidence-based dietary contribution to the biological environment surrounding the prostate. Consumed consistently over months and years alongside the other components of a prostate-supportive dietary pattern, they contribute meaningfully to the metabolic and hormonal conditions that determine how aggressively BPH progresses and how significantly symptoms develop. For men in their 40s building habits for the decades ahead, they are prevention. For men in their 50s with early to mild symptoms, they are meaningful complementary management. For men on active pharmaceutical treatment for BPH, they are a low-risk, no-interaction addition to a treatment program that addresses the biological environment medications alone do not target. A handful daily, raw or lightly toasted, unsalted, alongside a meal with healthy fat, consistently, not occasionally. That is the prescription, and it costs about the same as a daily cup of coffee. This is Dr. John. Sometimes the most powerful medicine is the least impressive looking one. I will see you in the next one.